All right, despite a lot of words, a lot of name calling on both sides, you've seen it all, both sides of the political aisle, Arizonans can agree there are really important issues out there, and one of them is health insurance. Our Nicole Gregg with a look at what it can take to have coverage.
The numbers, the stats, the reality of healthcare in Arizona. The latest numbers show 750,000 people in the Grand Canyon state are uninsured.
I just want it fixed.
And even those with insurance, like Eric Sanchez, fighting for affordable coverage.
That's why I trip and fall.
The Phoenix native on state health care with severe spine issues that makes his legs like spaghetti.
I tell people, don't pity me, like, this is part of life. But the part of life that shouldn't be a factor is having to fight to get health care.
And even with insurance, not everything is covered. Like long-term care, like nursing homes. There's fight for covering certain prescriptions and for things like in vitro fertilization.
75% of patients do not proceed with treatment due to the cost.
The fight for IVF coverage taking shape before legislators because here in Arizona, even with health insurance, IVF is not covered.
This January, we had our sixth miscarriage.
The cost out of pocket is daunting. Elizabeth Marshall has gone through 3 rounds of IVF.
It's not because I waited too late in life to have kids. It's not because I'm young, I'm not 50. It's not because I waited till I was much older in life to have kids. It's a medical diagnosis, and but they're not covering it.
She's not alone. Lauren Webb paying over $16,000 to start IVF.
I feel like when I used to think of IVF, you hear of celebrities getting in and it's almost glamorized. There's nothing glamorous about the process at all.
Why don't you look in the other oven?
She's just announcing it worked. This is her home video announcing not 1 but 2 buns in the oven, twins.
What got you through all this?
Just wanting to be a mom and my dream of having a family.
The fight for coverage will be long. This man gives some insight on the system, speaking on behalf of America's health insurance plans and Blue Cross Blue Shield. He says there's an insurance affordability crisis.
And look, you can mandate it, we'll price it, we'll pass the costs on. We're good at that. And for those on the individual market, we'll send the state a bill for the difference. So that's what's going to happen if this passes.
The fight for health care looks different for everyone, but it's one of few things Arizonans agree is a top issue.
I honestly believe there's people that are out there that are in worse shape than I am that are not getting benefits because they're getting denied.
In Phoenix, Nicole Gregg, ABC 15, Arizona.